Caroline Theoharides from Hammers College to tell us about her joint paper with Paolo Abarcar about medical work migration and origin country human capital, evidence from US visa policy. I should say I did not ask Caroline in advance, but I think she'll be happy to take clarifying questions during the seminar, and then we can leave a little time at the end for any other additional discussion. Okay, so the floor is yours, Caroline, please.
Perfect. About an hour, Katya, is that right?
Yes.
Okay, wonderful. Thank you so much for having me. It's a pleasure to be here and see lots of familiar names that we didn't get to see each other at the conference circuit this summer. So it's great to see you all. Incidentally, my family was supposed to spend 2 weeks in Portugal this summer. So I guess this is the next best thing until we can reschedule. So thanks for having me. So as Katya said, this is joint work with Paolo Abarcar, who's at Mathematica. And we're looking forward to getting your feedback on this today. There we go. So many developed countries face a shortage of medical workers. This is true for the United States. This is true for many countries in Europe, for Australia. And so to fill these gaps, countries often recruit foreign-born nurses. For migrant origin developing countries, this sort of recruitment may lead to a scarcity, or what economists often refer to as a brain drain, of healthcare professionals. This can lead to a negative externality, and so this type of brain drain is particularly concerning for policymakers surrounding the migration of healthcare professionals. The concern is that the migration of these workers could contribute to poor health outcomes for the local population. On the other hand, though, this sort of recruitment for high-wage jobs may actually induce more investment in education. So what we're thinking about here is that you see you're growing up in some developing country, you see these high-wage job opportunities abroad, you subsequently decide to invest in your education. If more individuals actually invest in education than end up migrating, this is going to result in a brain gain of these sort of healthcare workers. So this is just the typical brain drain, brain gain debate. Okay, so the causal question that Paolo and I try to answer in this paper is, what is the effect of demand for foreign-born healthcare workers on the stock of healthcare workers in the country of origin, as well as on the stock of educated labor overall in the country of origin? And so to do this, what we do is we're going to examine the effect of international migration of nurses from the Philippines on post-secondary enrollment and graduation of nurses and of other fields in the Philippines. We'll also look at the supply of programs in the Philippines. So we'll examine specifically how the supply of these types of nursing programs, as well as the quality of the degree, which we'll measure by looking at the nursing licensure exam pass rates for these different institutions. Okay, so to do this, what we'll use is we're going to exploit 2 changes in US visa policy, the first of which led to a large expansion of the availability of visas for Filipino nurses, and the second which led to a sudden contraction of these visas for Filipino nurses as well. Okay, so we have these 2 very sudden policy changes that occurred. We'll then exploit the fact that migrants from certain areas of the Philippines typically migrate to certain destinations and specialize in certain occupations. So there are certain provinces, that's going to be our unit of observation in the Philippines, that have historically sent lots of nurses to the United States. These networks have built up over time. There are other areas of the Philippines that have instead sent lots of migrants to Italy or something like that. And so they've specialized in these sort of networks. What this means for us is that when these policy changes occurred, some areas of the Philippines had a larger treatment dosage than others. Those that specialized in sending these nurses abroad were largely affected by these policies. Areas that didn't send nurse migrants to the US were less affected. Data event study methodology, where our treatment is going to be defined as provinces with high levels of nurse migration at baseline. And I'll talk about this more formally in a few slides. Okay, so just to give you a bit of a preview of our results, what we find is that the expansion of US nursing visas increased the migration of Filipino nurses. The subsequent contraction decreased the migration of these Filipino nurses. So effectively, we have a first stage here in terms of what's happening. The nursing enrollment increased after the expansion. It increased pretty dramatically. I'll show you in a few slides. And then it decreased when visas were reduced. Graduation rates responded similarly. So these people were actually persisting to their degree, but this occurred with a 4-year lag because of the 4 years that it takes to obtain a degree in nursing in the Philippines. So people responded, they enrolled, but it took them 4 years to finish. The supply of nursing programs also increased to allow for this sort of new enrollment. And this is, yeah, so I'll show you those results as well. On the quality side, however, the marginal nurse who was induced into a nursing degree was actually less likely to pass the nursing licensure exam. That said, there were so many people that enrolled and graduated from nursing school and subsequently took the exam that the increase in licensed nurses far exceeded the number departing. There was such a large increase in people who were taking and passing the exam. As a result, what we find is that for each new nurse who moved to the US, there were 10 new licensed nurses in the Philippines. Okay, so that would suggest that at least on the side of nurses, we're not seeing this brain drain phenomenon. In fact, we're seeing a pretty significant brain gain. However, what about overall? Okay, is this a brain drain or brain gain story? What we see is that there were increases, these increases in nurses were due to individuals switching to nursing from other fields, so largely switching out of fields like STEM and business. However, when these individuals switched, they persisted to graduation at higher rates when they were in these nursing programs, and so there was a slight increase in the number of college graduates in the Philippines overall. So in terms of contributions, we provide causal microeconomic estimates of medical worker migration on origin country human capital. And so we're adding to this really long and rich literature on brain drain and gain, starting with Katia and Pedro's really nice paper on brain drain and brain gain. There's also some nice work on the macro side. And then there are a number of other studies that use natural experiments to look at brain drain and brain gain. Okay, so Taryn Dinkelman and Martine Mariotti have some stuff in Malawi where they look largely at primary education. Stresha has some work in Nepal looking at British Gurkha migration. So these are largely lower levels of human capital attainment. Khanna and Morales look at IT workers in India. But we're going to really be focusing on this work on medical worker migration. We also focus on skill-specific migration, and this is something a bit unique relative to many of these other papers. The Khanna and Morales paper does the same thing, looking at IT workers, but focusing on this skill-specific type of migration, the concern in migration circles has largely been that post-secondary education may not be able to respond to skill-specific demand, okay? So sure, there might be seats for people to enroll in college, but there might not be seats for people to enroll in nursing school, and so we're gonna be able to test that explicitly. And to do this, we're going to actually measure those supply side effects of changes in nursing programs and changes in the quality of these programs to see what happens in this regard. We have unique data that's going to allow us to obtain really accurate estimates of skill prior to migration. So oftentimes when people measure brain drain and brain gain, they use destination country census data or survey data to see the levels of education of immigrants at destination. The problem with this is that many of these immigrants may have obtained their education once they got to the destination country. We're going to be able to assign education levels before these individuals actually leave the Philippines. So we can see that it's education that was invested in the country of origin explicitly. In terms of policy implications, our results refute the hypothesis of brain drain and show that there can be a pretty significant brain gain for these medical workers. I think our results are directly relevant to policy debates surrounding medical worker migration and the reliance of wealthy countries on medical personnel from developing countries. We have seen in recent years the WHO or other developed countries that have discouraged or banned recruitment from certain countries. I think our results highlight the importance of potential well-designed partnerships between migrant origin and destination countries. I'm going to leave you with a caveat though here, and we'll talk about this a bit more at the end. These results may not translate to all contexts, and I'm particularly concerned about the sub-Saharan African context in this regard. I think where our results translate well is if we're thinking about low to middle income countries that are seeking to facilitate migration as a development tool. So countries like India or Indonesia that follow this typical pattern of the Philippines of trying to facilitate migration for development. I think the case of the Philippines provides optimistic evidence that we may not see the brain drain that many are so concerned about and may in fact actually see a gain. So in terms of some background, the Philippines is one of the world's largest migrant origin countries. And so this started in the 1970s when Ferdinand Marcos began the Overseas Employment Program for the Philippines. This began as contract workers going abroad for a few years at a time, coming back to the Philippines, and really seeking this sort of facilitation of migration as a development strategy. The Philippines was one of the first countries to do this. Many other countries have followed suit, as I mentioned on the previous slide. In terms of nurses, Filipino nurses make up the largest group of foreign-born nurses. This is largely rooted in the colonial relationship with the United States. When the Philippines was a US colony, the United States set up many nursing schools throughout the Philippines, and they set them up in the fashion of US nursing schools. The training was conducted in English. In fact, much of the nursing licensure exam, 5% of it was exclusively just an English test to see if people could had some sort of English proficiency. And so as a result, this led to this pretty strong relationship between the United States and the Philippines in terms of nurse migration. The US is the largest destination for Filipino nurses with about 74%. That said, they migrate all over the world to lots of OECD countries, to the Middle East, et cetera. Filipino nurses in the US earn approximately 10 times higher salaries than they do in the Philippines. So this is a huge increase in the salaries that are available for them. The other thing that I think is important to mention is that they're able to obtain legal status for family members. This isn't true for all occupations, and this isn't true in all destinations, but this is a huge bonus for these Filipino workers that are migrating to the US as nurses, that they can eventually obtain green cards and citizenship for their spouse and children. Okay. Migrant networks are an important determinant of nurse migration patterns. They're an important determinant of migration patterns in general in the Philippines, but the historian Catherine Choi has some really nice work showing that these nurse migration networks are particularly important amongst these nurses. Okay, so thinking about the US recruitment of nurses, the most common channel for foreign nurses to migrate to the US is through permanent employment-based visas. These are called EB-3 visas. There are about 140,000 EB-3 visas that are granted each year by the United States, and nurses are considered a Schedule A occupation. And so what a Schedule A occupation is it's an occupation in the US where the US faces a shortage, okay? And so this is true for nurses. As a result, Schedule A occupations, nurses, experience shorter processing times as a result of these shortages. The Philippines, like any other country of origin, can't receive more than 7% of EB-3 visas granted, okay? And this is always binding for the Philippines. The Philippines always hits this 7% cap, and there are many more individuals who would like to come to the US. This is true for Mexico, for China, for India, and for a number of other countries. So for the Philippines, the demand for visas is going to far exceed the supply of the visas that are available. Okay, so what are we thinking about specifically for the policy changes in this paper? So the first policy change that we'll be looking at is called the American Competitiveness in the 21st Century Act. This occurred in 2000, and what this did was this loosened the per country limits in visa allocation. So that 7% that I told you on the previous slide, this was loosened, and countries like the Philippines were able to obtain a larger portion of these visas. There were approximately 200,000 additional visas released to Schedule A occupations. So this was a huge influx of visas that were available for nurses from the Philippines to come to the US. In 2007, however, there was a severe contraction in terms of this policy. The processing of these Schedule A visas stopped. The extra visas that were made available were used up. Okay, to give you a sense of the magnitude, in 2006, we see about 6,800 nurse visas processed from the Philippines. This fell to about 2,300 in 2007, and it stayed low following that. So to give you a sense of what this looks like, the black line with the black dots are US nurse migrants, and these are calculations that I've calculated from our data. And so you can see that this is relatively flat throughout the period prior to 2000. We start to see these nurse migrants to the US ramp up following the 2000 contraction, or the 2000 expansion. 2006, the visas contract, and we see this large drop off that recovers a bit, but if we were to extend this out further, it stays relatively flat. We never return to these high levels, okay? Non-US nurse migrants, this is the dotted line at the bottom, okay? We see an uptick starting around 2008, 2009. This is largely nurses going to Canada during this period from the Philippines, okay? And then I've also plotted on the dashed line non-nurse migrants from the Philippines. These are permanent migrants that are leaving the Philippines, not on these 2-year cyclical contracts, but are permanently leaving the Philippines. And I'll talk a little bit more about the data in a few slides.
Sorry, Caroline.
Yeah.
By permanent, how do you define that?
Yeah, so they're migrants that are, they are not going on the sort of 2-year temporary contracts where they might be going to the Gulf or something like that to work for 2 years and then renewing those contracts. They have a visa to go to the US and stay there, apply for a green card, that kind of thing. Does that make sense?
Yes.
Okay, perfect. And I can talk a little bit more about that distinction with the data too. Feel free to follow up on that.
Thank you.
Yeah, awesome. Yeah, and feel free everyone to jump in if you have questions.
Yeah, Caroline, I had a question. So can you tell us more about so is there a reason behind those changes in policy?
Yeah, so part of what happened, so there are a few different things that happened. Part of what happened was in 1999 and 2000, there were a whole bunch of visas that were unused. So many countries are hitting this 7% cap, like the Philippines or China, but there are a bunch of countries that aren't really using up these visas. So there are about 140,000 visas that were unused that the US decided to make available starting in 2000, and they specifically allocated them toward these Schedule A occupations where there were shortages, of which nursing is like the most important. So there was that, and then there were some other so not only did those visas became available that hadn't been used, and they were able to be used by countries that had hit their target. So that's largely what's going on here, is some flexibility in that regard. Now in 2007, what happened was these visas that had been made available were used up. And so suddenly they had been processing all these visas, lots of nurses were applying, suddenly they'd been used up, there were no more available. And we found some nice evidence, some quotes by US immigration officers to Congress saying that in 2007, they had no idea how many visas had been processed or how many were available, suggesting that this was pretty sudden. This wasn't something that nurses in the Philippines could have predicted in terms of how many visas were left. Does that help, or do you have other specific questions?
No, that's what I meant.
Okay, perfect. Thank you. Great. So in terms of brain drain or brain gain, the Philippines is a really nice setting to study this in because it provides a compelling example of exactly where we might expect a shortage of domestically employed nurses. We've got sort of this perfect storm of this education system that's been set up in a way that the US and many other countries are very happy to recruit these nurses. There are super high returns, and so we might expect that we would see this type of brain drain. In fact, government officials in the Philippines have been quoted as saying that the migration of nurses is not a brain drain, quote, but more appropriately a brain hemorrhage of our nurses. Okay, so there was a lot of concern about this at the time that this was going on. However, despite this fear, I want to show you some aggregate evidence that the post-secondary enrollment and graduation data actually suggest the opposite effect. Okay, so what I'm showing you here, I'm showing you enrollment and post-secondary education by discipline. Okay, and so these are from the data that we'll use in the paper. And what this shows is the number of students enrolled. Let's see. Just lost all of your images, but okay, there you are.
You're still here.
Okay, perfect. Awesome. Thank you. So what this shows is the number of students enrolled in thousands. Okay, and so what you can see is that, the nurses, which are the black line with the dots, you can see that this is pretty flat, even declining up until 2000. 2000 happens and we have this expansion in opportunities to migrate to the US as a nurse. And we see this really dramatic increase in the number of nurses. This is just aggregate data for the entire Philippines from the Commission for Higher Education. So we go from about 100,000 nurses in 2000 to about 500,000 in 2005, 2006, okay? We then subsequently, so this gray line right here is the 2007 contraction, and we see this start to decline. It appears people are staying enrolled. So this is 4-year enrollment data. So it's first years, second years, third years, and fourth years. It takes 4 years to obtain a nursing degree in the Philippines. So this is a bit of a gradual decline. I think this is largely driven by the fact that first years are not enrolling in nursing programs anymore, but those that were already enrolled are sticking through with the degree, and we start to see this decline. Now, in terms of other disciplines, you can see that this has sort of the opposite effect. We're seeing suggestive of what I'll show you more causally later, that we see this switching behavior from these other fields. We see this dip down while nurses are increasing, okay? Now, in terms of graduation, they started collecting graduation data a bit later. So my first year of graduation data is 1998. So that's why I have a little bit shorter time series. But what you can see here is that, so the expansion happened in 2000, contraction in 2007. Well, it takes 4 years to obtain a degree, so we can't see an immediate response in terms of graduation. But we see a very similar picture if you look at this nursing line, the black line with the dots. However, it's with a 4-year lag. Okay, so people enroll, 4 years later, they begin to graduate, and we see this similar shape pattern here. Okay.
So one question.
Yeah.
So why are these numbers actually reacting so closely to visas? Is this because the schools are actually, intaking students as in response to some visa regulation, or is it just that people knows very well what is the visa?
Yeah, I think it's probably a combination of both. I think that that there's a lot of knowledge in the Philippines about these sorts of opportunities to migrate. I have like a distinct memory of being in the Philippines in like 2007, and I was in a really remote part of the Philippines talking to some kids, and all of them had older sisters who were training to be nurses to go abroad. I think there is sort of this sense that migration as a nurse is a bit of a golden ticket, and so lots and lots of people want at least one of their daughters usually to become a nurse. And so I think people were pretty aware when these visas became more readily available. Talking to nursing recruitment agencies, they described it almost as like a very sudden response in terms of people suddenly realizing that these visas were there, that they had a chance, and going after this. I think because the returns are so high. That said, I'm going to show you that the supply responds pretty dramatically in terms of availability for these nursing programs. And I think and so I think that is kind of what allows for this, right? Is that not only was there demand through people seeing these visa opportunities, but they're going to be slots available for these individuals as well. So in terms of the data that we're going to use here, the data that we have are from the Commission for Filipinos Overseas, or the CFO. And this is administrative data on all permanent migrant departures from 1990 to 2014. So going back to Katya's question, these are workers that are going to be going abroad and planning to stay abroad. They're not doing these sort of cyclical contracts. And some of my other work that I know I've talked about with some of you, I've used temporary contract data, which are people that are going for 2-year contracts, largely to the Middle East or to countries within Asia. Okay, so what we have here, we have information on demographics, we have the place of birth, the country of destination, education, profession, etc. Incidentally, my co-author Paolo, his father migrated to the US as a nurse during this time period. So, we haven't looked for him in the data, but one of the reasons we knew about this data is because Paolo's family filled out these forms in order to migrate to the US. So they basically are keeping records of anyone who leaves. The Philippines has really good records on anyone who's going abroad. You have to show that you have certification from this government agency at the airport as you're leaving. Okay, so the fact that we have really detailed data on their country of destination and their location of origin in the Philippines, so not just their place of birth, but where they were prior to migration, we can calculate province-level migration rates for nurses. Okay, so for each province in the Philippines, we're able to see how many people were migrating as nurses and how many people were migrating as nurses to the US. We also have data in terms of post-secondary enrollment and graduation from the Commission on Higher Education. And these data are disaggregated from 1990 to 2018 by program of study. Okay, so what we're able to do here is calculate enrollment and graduation rates for nurses, as well as look at the number of nursing programs in each province over time for the Philippines as a whole. Okay, so I think the combination of these data are pretty unique to be able to assign, I think it's rare in migration research to be able to assign both where people are coming from and exactly where they're going to. So the CFO data are nice in that regard, and then the CHED data on top of that allow us to look exactly at province-specific enrollment and the supply of schools. Okay, so just some quick summary statistics. What we have here, so the first panel of the table are the migration rates. And so these are out of as a percent of the working population. So these rates are low. So you can see that as a percent of the province working population, about 0.08% of individuals migrate. Okay, about 0.004% migrate to the US as nurses. So these are low rates of migration, but they're going to prove pretty important in terms of the decisions that people are making in terms of their education. In terms of post-secondary enrollment rates, these are divided by the college age population. Okay, so 18 to 22-year-olds. This is about 21% of the college age population in the Philippines during our sample period is enrolled in post-secondary education. About 1.5% are enrolled in nursing programs. In terms of graduation rates, about 3.8% of the population, of the college age population, graduates in a given year. So you can see that not everyone is persisting to degree. If everyone were persisting to degree, we would expect that the 21% divided by 4 would give us our graduation rate. It's a bit lower than that because not everyone's finishing in 4 years. In terms of the total number of nursing programs, there are about 4 nursing programs on average in a given province. Most of these programs are private. About 3.75% of them are private programs, and there's about a half of a public program in each of these provinces. And I'll talk about the nursing licensure exam in a little bit later. Okay, so in terms of our empirical strategy, what we're going to do here is we'll exploit plausibly exogenous policy changes that occurred in 2000 that expanded these visas, and then in 2007 that is restricted visas for nurse migration to the US. Okay, I think the aggregate figures that I just showed you in terms of the nurse migration as well as the enrollment and graduation rates provide some nice suggestive evidence of the impacts of the policy changes. I think they're pretty striking in the aggregate. However, what we want to do is we want to isolate the causal effects. And so to do that, we're going to exploit the importance of migrant networks. And so just in words, what we're going to do intuitively is we're going to compare high baseline nurse migration areas, that'll be our treatment group, to low baseline nurse migration areas as our control group before and after these 2 policy changes. Okay, so more formally, what we're doing is we're estimating a pretty standard event study specification. Okay, so our outcome variable YPT will be nursing enrollment or graduation in province P year T. Okay, we regress this on the interaction of this variable high and DT. Okay, so high is a binary variable equal to 1 if a province has above median nurse migration at baseline. Okay, so these are our higher nurse migration provinces. And then DT is the binary variable equal to 1 if the year of observation T equals the specific year and 0 otherwise. Okay, so what you can think about for these beta taus is it's the effect of being in a high nurse migration province relative to a low nurse migration province in a specific year. We'll also include province and year fixed effects, alpha P and gamma T, as well as baseline controls interacted with year fixed effects. That's our XP0 term. Okay, we're going to omit 1999 in order to identify our model. That's the year prior to the first policy change, the expansion of visas. Okay, we also estimate a pooled event study, and I'll show you these results in all of our figures. The reason that we do this is these are going to be a little bit easier to interpret in terms of the magnitudes. So the event study is giving us a coefficient for each year. This is going to pool these estimates together so that we can think about the magnitudes. All I'm doing here is I'm going to represent the year 2000 by T1, the expansion year, and the year 2007 by T2, that's the contraction year. And so what we have here, this first term, this beta post 1, that's going to be the initial jump that occurs right after the policy change in 2000. Then I have this term beta trend 1, which is going to be multiplied by high and an indicator for that we're after 2000 times T minus T1. Okay, so a trend term. And so what this will give us is the delayed annual changes in outcomes after that initial jump. Okay, we do the same thing, the second line of the equation, we do the same thing for after 2000. So beta post 2 gives us the immediate change in outcomes following the 2007 contraction. Beta trend 2 gives us the delayed annual changes that are happening post contraction. Okay, and then this term beta trend, this is our check for pre-trends. Okay, so this beta trend term, this is looking at the pre-period trends. And then we have all of our fixed effects in here as well. And so I'll show you these results on all of my event study pictures as well and show you that this tracks pretty closely. It makes for a bit more intuitive tables, I think, in the paper in terms of interpreting the results. Okay, so our identifying assumption, standard event study identifying assumption, in the absence of the policy changes, our high nurse migration provinces would not have experienced differential changes in outcomes compared to our low nurse migration provinces. So if this assumption holds, we should not reject the null hypothesis that the beta taus prior to 2000 are equal to 0. So that's in this specification. Prior to 2000, these we do not want to reject the null hypothesis for our identifying assumption to be valid. For the pooled event study, we should not reject the null hypothesis that beta trend is equal to 0. Okay, so similarly that those pre-trends are equal to 0. All right, so what are some threats to this identification strategy? Okay, so we might be concerned about differential trending of outcomes by high and low nurse migration provinces. So we do have province fixed effects here. So that's going to control for any differences that we have in the levels between high and low nurse migration provinces. And we also are going to include baseline controls interacted with year dummies. Okay, so we have controls, for instance, for female employment in the province, and we interact that with year dummies in case there's something that's trending differentially for female employment by high and low nurse migration provinces. Okay, so the other potential concern that you might have, and I'll also show you the pre-trends throughout in the event study pictures so that you can see for yourself that they look good. So in terms of another potential threat, you might be concerned that there could be economic shocks or policy changes that are correlated with both nurse migration and the outcome variable. Okay, so maybe there was some sort of change to the healthcare system that occurred in the year 2000 that both affected high nurse migration provinces more and affected the enrollment in nursing programs, new hospitals that were built, something like that. And so what we show in the paper, we have a table that looks at the number of hospitals and the number of barangay health clinics, those are village clinics, over our sample period. And you can see that there are no major changes to the healthcare system during this period of time. I also went through in pretty good detail WHO reports and Philippine Department of Health reports to show that to discover that there were no major legislative changes that were occurring that would affect this sort of demand for nurses that were occurring simultaneously. So we're optimistic, at least, that there were no other shocks that were occurring that are confounding our results. In the paper, we show robustness to a number of things. So specifically, we show that our results are robust to including a control for baseline non-nurse migration times year fixed effects. Okay, so you might be concerned that that high nurse migration areas also send lots of other nurses, and so this could be leading to changes in demand for nursing school. Okay, remittances are coming back, people are enrolling in college at higher rates. We show our results are robust to that. We also show they're robust to dropping Manila. Manila is the capital city. It's a bit of an outlier in terms of having really high rates of migration, really high rates of education. Our results are robust to dropping that. We add some additional baseline controls times year fixed effects, and then we also add island times year fixed effects, so splitting the Philippines into the northern part, the central island region, and the southern part, basically to assuage concerns that there could be differences in economic growth in these island regions. So the northern island is where Manila is. It's where a lot of the call centers are that are happening in the Philippines, things like that. And since we're in the year 2007, where we're getting close to the global financial crisis, we wanted to control for that as well. Okay, so moving to the results, I'm going to first show you these first stage results. So looking at the effect on nurse migration to the US. If we don't see an effect on nurse migration to the US from these policy changes, we wouldn't really expect to see much in terms of enrollment. So what I'm showing you here, the black line are my main event study estimates. The 95% confidence intervals are shown by the dotted lines, the light dotted lines. The dashed line, those are the pooled event study estimates. So you can see that those track pretty closely. Okay, so 2000 is the expansion, 2007 is the contraction. You can see that following the expansion in 2000, there's a pretty dramatic increase in the percentage or the share of people that are migrating to the US as nurses. Following the contraction in 2007, this declines pretty dramatically. We have a slight downward pre-trend in the pre-period. Okay, it's much smaller in magnitude and of the opposite side of what we see in the expansion. What's going on here is that provinces that typically did not send nurses are starting to catch up during this time period. They're starting to send more nurses. They're starting to have more migrants that are going abroad. And so we see this slight downward trend. But following the expansion, the places that have historically sent nurses are going to be much more impacted by this. Okay, in general, to give you a sense of the magnitude of the effect, this initial jump that we see here is about a 50% increase in the number of nurses that are migrating to the US. Over the entire period, this is about it's about a 120% increase in the number of nurses that are going to the US. Okay, so turning to the effect on nurse enrollment, so the figure is set up in exactly the same style, with the black line being the event study estimates and then dotted line being our confidence interval. What you can see here is that this looks a lot like the aggregate picture, right? So what we see is in 2000, whoops, I'm sorry. What we see is that in 2000, we see this dramatic expansion in terms of the number of individuals that are enrolling in nursing school, the enrollment rate, and then we see this begin to decline following the contraction in 2007. Again, we've got this slight downward pre-trend. It's not statistically significant, and again, it's of the opposite sign and much smaller in magnitude as well. This represents about 156% increase in enrollment that we're seeing for these nursing students. So, and I'll talk a little bit more about the magnitude in just another slide, but I want to show you these pictures first. So moving to nurse graduation, recall that I don't have as long of a pre-period, but what you can see here, our pre-trend is effectively leading up until 4 years after the policy change. So it's about until 2004, so about right here. You can see that this is very flat between the two groups. We then start to see this expansion 4 years after. So it took 4 years for these individuals to graduate from college. We then see this really dramatic increase in the share of people that are graduating from nursing school, followed by a decline 4 years after that. Okay, so again, following what we saw in the aggregate pictures. Okay, so what does this mean in terms of magnitudes? All right, so what we're finding here is that the average effect on nurse graduation during the expansion increased by about 0.39 percentage points per year. Okay, we've got a pre-period sample mean nurse graduation rate of 0.13%. Okay, this is of the college age population. So what this means is that the visa expansion led to about a 290% increase in nursing graduates, or 783 new graduates in the average province. So this is a really dramatic expansion. In terms of how many people are leaving, going back to the very first graph I showed you, there are about 30 new nurses departing in the average province year during the expansion period. Okay. Well, so what this implies is that for each additional nurse, there are about 26 additional nursing graduates. So this is a huge effect. But before you get too worried about how big this effect is, let me have you think about the aggregate response. Okay, so if you think about the aggregate, what we saw was that in 1999, there were about 1,200 nurse migrants to the US from the Philippines. There were about 7,300 in 2006. So a dramatic increase, but not that many for a country of 100 million. However, what we saw in terms of graduates was that in 2002, so 4 years after this, there were about 11,000 nurse graduates. And then in 2009, there were 113,000 nursing graduates. So even in the aggregate, we're seeing this very pronounced response to, sure, there's an increase in nurses, but the graduation response is quite large. Okay, so let me move to the supply of schooling. Okay, so as I mentioned at the beginning, proponents of brain drain often will argue that even if the returns to schooling are such that they could induce enrollment, okay, so there are these high wages in the US, there's also the potential for getting legal status for your family. So even if these returns are there, supply constraints are such that individuals actually can't enroll. And they say that this will be particularly true for specialized occupations where it's going to be much more difficult to, build a nursing school or build an engineering school, something like that. So what we're going to do, we see these enrollment responses, but we're going to explicitly look at the effect of these policy changes on the number of nursing programs in the Philippines. So this is just in the aggregate. I'm showing you nursing programs over time, and I've denoted the 2000 expansion and the 2007 contraction. So you can see that there's really dramatic growth between 2000 and 2007 in terms of the number of nursing programs. Of course, this could just be, this is just in the aggregate, this could just be that the education system in the Philippines overall is expanding during this time period. And I don't think we want to assign anything causal to this result here. So what we do next is we take this supply of nursing programs and we put this into our event study. Okay, so we're looking at the number of nursing programs in a given province year. You can see that this increases really dramatically following the expansion, declines very slightly following the 2007 contraction, but generally has expanded pretty dramatically. And there's no evidence of a pre-trend here. What this translates to is an increase of approximately 0.5 new nursing programs per year. And so we're seeing a really large expansion in terms of these nursing programs. Where are they coming from? Well, they're largely coming from private programs. The left graph are private nursing programs. The right-hand graph are public programs. Public programs are much smaller in magnitude. I showed you they're about 0.6 in the average province. So in terms of a percent, the public programs are noisy, but it's actually a larger percentage of the increase. But certainly the private results are perhaps more striking, and we're seeing this pretty precisely estimated large increase in the number of private nursing programs. Okay. Now, incidentally, in talking with individuals that I know in the Philippines, there was this really dramatic expansion. And so actually many of these individuals that didn't migrate to the US, this is just sort of an anecdote, actually ended up working in some of these nursing schools as well. And I can tell you more about those stories if you're curious.
One question.
Yeah, for sure.
So the fact that you observe very large standard errors specifically for the private school, is it because private schools are located in, so you get this expansion in very specific locations? Is it something that is equally distributed across the country, or it's happening just in very specific location, which they triple the number of programs?
Yeah, I think it's more like the latter, that we're seeing there are specific areas of the country that are having this pretty dramatic increase. So places that, we're having a lot of these nurse migrants. I could look at that more specifically. It's not regional per se, that it's like, only in the northern part of the country or something like that. Like these results hold up to when we're controlling for some of the region specific trends. But I should look a little bit more at that variation. Because are you thinking that can kind of explain why there's such a large standard errors here?
Could be an explanation. Maybe because they're located in cities, and
yep.
And then maybe you don't capture much in rural areas. I have no idea, but that could be an explanation, I think.
Yeah, that's a great suggestion. Because that's definitely something that people have brought up, but no one's had a really much of a solution for it. So I will absolutely look at that. Yeah.
And the other question I had is, so what if there is a lot of more people entering into these programs? Do you have any evidence of what they would have done if there were no such a program? They would have just not gone into these programs, or they would have taken other alternative.
Yeah, so I'll talk about that a little bit more. Yeah, absolutely. So I can talk about that a little bit more a bit later too, but just sort of as a preview to that. So they're switching largely. It's not like the marginal person is coming from, they weren't going to go to college and now they're induced into college. They're coming out of other programs. And so I think one of the sort of concerns that I have in terms of like the overall welfare implications is, suppose that I was going to be an engineer and I was going to improve infrastructure in the Philippines really dramatically. And then I decide to become a nurse. I don't migrate as a nurse and I end up working in a call center, something like that. There might be some welfare implications that we're not really capturing in these estimates per se. And so at the end of the paper and at the end of the presentation, we try to get at that a bit by trying to look at what some of these counterfactual options are. But I do think that that's one of the limitations of the paper, is that we get, I think, pretty nice partial equilibrium estimates, but we can't say much about the general equilibrium implications beyond some sort of limited evidence that I'll show you a bit later on. But if you have suggestions of how we could do that, I would love to hear them, because I do think that that's one of the main limitations of the paper right now. So I'll get to those in just a couple of minutes. But before I do that, I want to show you some of these results on the quality of these nurse migrants or of the marginal nurse. So what we're thinking about here is we've got these marginal nursing graduates, and this kind of goes to Alex's question about who are these people that are getting induced. And so if we think about the marginal nursing graduate, what we'd like to know is the person that's induced to get a nursing degree and graduates, are they of the same quality as graduates before the policy change? You might think that new graduates may be less skilled because I'm showing you that there are all these new schools. And if we're suddenly building all these new private institutions, maybe they're going to be less rigorous. Maybe the training is not going to be as good. And so these individuals will be of lower quality. Could also be that the students themselves are weaker. Now more marginal students are being induced in and they're not as good academically. Okay. So what we're going to do to look at this is we're going to use data on pass rates from the Philippine nursing licensure exam, the NLE, in order to measure nurse quality. So the NLE, individuals have to pass this exam in order to practice nursing in the Philippines or to apply for jobs abroad. So if you were to come to the US, for instance, you would have to pass the NLE in the Philippines, and then you would have to pass the US nursing licensure exam. To take this exam, you have to have a bachelor's degree in nursing, which is a 4-year degree. In the aggregate, what I can tell you is that national pass rates declined over our sample period, but again, we don't necessarily want to attribute anything causal to that. So we'll look at that in this event study framework. Okay, well, what we'd like to know is how the pass rate, defined as passers divided by examinees, responds in our event study framework. However, we have numerous provinces where there are years where no one takes the exam. So particularly in our control group with low nurse migration, we have a bunch of provinces that don't have any examinees, and so this pass rate would be undefined. In the interest of not changing the composition of our sample, we instead decide to look at the number of passers divided by the population and the number of examinees divided by the population. And so I'll show you those results now. So what this shows us is that the blue line is passers out of the population and the orange line is examinees out of the population. And so what you can see is that following the policy change with about a 4-year lag again, because they actually have to graduate from nursing school in order to be able to take the exam, we see a pretty dramatic increase in the number of passers, and we see an even larger increase in the number of examinees, okay? And again, no pre-trend. Now, this is useful. We've got more people passing the exam and we've got more people taking the exam, but it's probably not that surprising given how many more graduates we have, that more people are going to be induced into the exam and subsequently pass the exam. So what we'd really like to be able to see is this passers divided by examinees. So what we do to try to get at this is we estimate 2 regressions in just a basic diff and diff framework, where we're comparing high nurse migration provinces to low nurse migration provinces in the pre and post period. We also do this in the event study framework, but I'm just going to show you this as the overall diff and diff here. Okay, so we've got this estimate and we show that there's about a 3.3 percentage point increase in passers out of the population and an 8.5 percentage point increase in examinees out of the population. What we then do is we divide the passers out of the population coefficient by examinees out of the population coefficient to get an implied pass rate. Okay, so just this 0.03 divided by 0.08, giving us an implied pass rate of 39%. Okay, I then test this against the pre-period pass rate of 58%. So that's prior to 2000. And we're able to reject the null hypothesis that the pass rates in the pre and post period are the same. Okay, so this would suggest that the pass rates fell pretty dramatically from about 58% in pre-period, 39% in the post-period. So this would suggest that there's a pretty large decline in quality of these individuals. And now any changes in the test that would have happened, this is a national exam, they would have happened over the Philippines as a whole. So we're not worried about this being differential by high and low nurse migration provinces. So pass rates fell. That said, despite these lower pass rates, so many people took and passed the exam as a result of the visa expansion. Yeah, go ahead. Yeah, for sure.
Question, just to be sure. I mean, I don't know in Philippines. I know in France, there's some sort of like implicit or sometimes explicit pressure on examiners to not give too good grades. Like they kind of have an expected failure rate. Could that a little bit play a part here?
Yeah, I think, yeah, that's interesting to think about. I think that, so 2 things. So I think that because it's a national exam, I don't think that that would affect my treatment and my control group differently. So we would still expect that, if they were harsher, which I think could happen, if they were harsher, then that should affect kind of all of the Philippines the same way, because the exams are sent to like a centralized location and graded. So I think that that should be okay. I think if anything, my concern would be that they're grading to easily because the Philippines wants to facilitate this migration. That said, I think they also have this reputational component in place where they want to be seen as the world supplier of nurses. And so they also don't want to make the exam too easy. But that's an interesting point. I can chat with some people at the licensure exam board a little bit more to see if I can get more evidence on that.
Already, if it's a national grading, it's a really cool and important point. I was asking the question because I know that in the case of France, it's not national the way it's graded, so you do have local influence. Sorry, Kat.
Okay, interesting. Yeah, so there's 12 test centers around the Philippines, and then they all go back to Manila to be graded. But I should emphasize that in the paper because I think that is something that lots of people are going to have in mind when they're reading this. So thank you. Katya, did I hear?
A minor clarification. So this is just a pass-fail exam, so there are no grades or anything like that. There is not a distribution of grades. It's just pass or fail.
It's just pass or fail. Yeah. Unfortunately, we only know from the data. So we got basically hard copy documents of the pass rates at every nursing school in the Philippines from the 90s through the present. And so we know the number of examinees and we know the number of passers. We also do know how many people are retaking the exam from that nursing school. So we could that doesn't get at the distribution, but it gives a little more information. Yeah. Awesome. Thank you. Let's see. Okay. So yeah, let me just emphasize this last point, though, that despite these lower pass rates, there were so many individuals who took and passed the exam as a result of the expansion that even though the pass rates are lower, what this led to was that for each new nurse migrant, there were 10 new licensed nurses at home. So even though the quality is lower in some sense, people are passing that benchmark and becoming licensed. So the next thing that I want to look at is the effect on non-nursing enrollment. Okay, so specifically, did this policy change increase the overall stock of college-educated labor in the Philippines? So I've shown you that for each new nurse migrant, there are a bunch more individuals who were licensed in the Philippines as nurses and who stay in the Philippines as nurses, or stay in the Philippines, whether or not they work as nurses, we'll talk about in a couple of minutes. But did this change the overall stock of educated labor? Sure, we see a brain gain in terms of nurses, but what about overall? So we look at the total enrollment rate in panel A by non-nurses, and then the total enrollment rate overall, which is non-nurses plus nurses. So there's some, the estimates are noisy for sure, but there's at least some suggestive evidence that the non-nursing enrollment rates are following this opposite pattern. Okay, so they're declining following the expansion, and then they start to increase once nursing visas to the US are less readily available. If we look at the total enrollment rate, these are essentially flat, okay, which is supporting this story of people switching from non-nursing programs into nursing programs, okay? So we're really not seeing any effect on enrollment. We next look at graduation, however. And so what you can see in terms of graduation is the non-nursing graduation rate is relatively flat. The total graduation rate appears to increase. And if we test the joint significance of these coefficients in the post-expansion period, we find that there's a statistically significant impact jointly of these coefficients, suggesting that there's an impact in the total graduation rate. In this case, we can't reject the null that they're equal to 0 jointly. So what this suggests is that people are graduating at a higher rate following this post-expansion period. And so this is leading to about 126 new graduates in the average province. Okay, so in other words, we're not finding an effect on enrollment, but we are on graduation. So there's something about these nursing programs that's leading people to persist to graduation at a higher rate than if they were in other programs. Now, whether that's something specific about nursing programs that you want to complete that degree, there's not much of a return to part of a degree, or this siren call of potential migration is leading people to persist. I'm not sure about the mechanisms, but we are finding that overall we are seeing that there are increases in overall human capital of 126 new graduates in the average province. Okay. And so then kind of getting back to Alex's question that he had several minutes ago, what happens to these nursing graduates who don't get a visa? Okay. So what I can say, largely anecdotally, I can tell you that there's a very small share of migrants the very small share who migrate as nurses to other destinations, okay? So who are going to Saudi Arabia or who are going to the UK or to a variety of other countries. And so we're able to look at this both in terms of our permanent contract migration data, the data that we're using in this paper. And then as I mentioned in response to one of Katya's questions, I also have data from some other work that I've done on all temporary contract migrants from the Philippines from the early 90s to the present. And so we're able to see that they're not really, you know, there are some that are going, but it's not going to explain, it's not going to take up these 10 new licensed nurses for sure. We also can see that these increases don't appear to be observed by temporary contract migrants going as domestic helpers or caregivers. In fact, during these periods, there were contractions in the number of domestic helpers that were going, largely due to barriers that were put in place by Saudi Arabia. This is something that many people have proposed before, is that, you know, now I have a nursing degree, I'm not able to migrate as a nurse, but I'm going to be really well qualified to be a caregiver taking care of, you know, your elderly mother or something like that. And so certainly some of that is happening, but the numbers are relatively flat during this period, so they're not going to absorb our entire increase. The other thing that we look at, we use census data. So we have observations from the 1990, 2000, and 2010 census. And we show that there's a large increase in nurse employment in the Philippines in the 2000 to 2010 period. Doesn't appear to be driven by pre-trends, which we're able to check from 1990 to 2000. And so we're wondering, you know, what led to this increase in nurse employment? So are these people actually able to work as nurses in the Philippines? As I mentioned before, there were no major healthcare expansions during this time. And so it seems that what drives this increase in nurse employment are a couple of different things. So first, there's the RN Heals program, which is something that the Philippine government set up in response to this huge supply of nurses as a result of this visa policy change. So the RN Heals program seeks to use nurses that are in higher nurse migration areas or our high nurse migration provinces here and bring them into underserved areas in more rural parts of the country. Okay, so specifically what they do is you do a 6-month stint getting experience in an underserved area, and then you do a 6-month stint in a hospital in your locality. You're still counted in the census in your province of origin, and you're counted as a nurse. So this is what part of that increase is. The other thing that is going on is that in order to migrate abroad, you typically need experience as a nurse. And so a huge industry has developed around professional volunteer nurses in the Philippines, where young recent graduates will actually volunteer to work in a hospital for free. They're counted as nurses in the census. That's what they're employed as effectively, but they're not actually being paid for this. So a lot of it is driven by that. Now, what about those that don't pass? Okay, because sure, there were 10 new people that passed for each nurse migrant that went abroad, but there are about 16 that don't pass. So what are they doing? Well, the Philippines implemented some other programs in terms of they became universal healthcare implementers or public health associates, going out into rural provinces, using some of the skills that they have about public health and about nursing and doing public health advocacy work. Many are also working in business process outsourcing. So the Philippines has the largest share of voice call center operations in the world. They surpassed India a few years ago. And so many are working in these BPO centers. Some are working specifically in call centers that are related to nursing or healthcare, insurance companies. Others are just working more generally. In talking with a number of individuals I know that are nurses in the Philippines, they said that the salaries are so great in these BPOs that many nursing graduates, even if they pass the exam, if they're not able to migrate, they would choose to work in these BPOs over working as a nurse in the Philippines because of the high returns.
So I was wondering about, Caroline, you're putting it as, now we have too many nurses, and so let's do something about them. But I was wondering about a slightly different story, which is a story of institutional influence of the migrants, of the people in the US. So, yeah. So maybe those people could be actually trying to improve the healthcare system I mean, it's a matter of now the standard is a bit different because these migrants are more empowered and they could influence the system at home in a way to improve it. So that's to a certain extent compatible with what you're showing, but it's a different story in a way. And also, that's one point. The other point is related. I mean, the evidence that you're showing, to a certain extent, I mean, it's unless there is an informational problem, a substantial informational problem. I mean, these people's aspirations. I mean, for some of them at least, they must be to stay at home, to be nurses in the Philippines. So it would be nice to know. I mean, maybe it's difficult to get this data, but maybe a sense of what are the aspirations of these people when they start. It's crucial to your argument to a certain extent. I mean, even if it is, I mean, qualitative data, it could help a little bit. But thanks.
Thank you. That's a great suggestion. I think I can definitely get at least some sort of qualitative data in response to that. I think that is an important point to make. In terms of your other story about the institutional influence of migrants, I think that's great. Nobody's suggested that. I've presented this paper a bunch and nobody's brought that up. It's a great suggestion. And I think it's actually what the Philippines is sort of trying to facilitate in many ways. So the CFO, where we got our data from, they actually have set up these diaspora programs where they'll bring over children of Filipinos that are, in the US, for instance. They'll bring them back to the Philippines for a summer to like work in their office and connect them to the homeland, that kind of thing. They've also set up these hometown associations. Andreas and Toman have a paper about this where they're looking at trying to facilitate like remittance dollars coming back, not just to families, but to like hometowns as well. And so I think like that is very much the structure of like how the institutions are trying to think about it. And so I don't know, I've got to think about a way that I can maybe explore that a little bit more, but I like that idea a lot. So thank you for that. So just to conclude, what we show here is that employment and graduation from nursing programs increased dramatically, and the number of nursing schools rapidly expanded in order to accommodate this increased demand. Although we show that nursing students pass the exam at lower rates, the increase in licensed nurses outweighed the increase in nurse migration. And specifically what we show is that for each additional nurse migrant, 10 more graduates pass the licensure exam. We also show that there was an overall increase in the stock of educated labor as these individuals are persisting to degrees at higher rates. Now, in terms of welfare, and this goes a little bit back to Alex's question, in terms of benefits, the Philippines gained more nurses and many worked in underserved areas. Those who migrated experienced huge gains in wages, legal status for their family, and they sent large volumes of remittances back to the Philippines. However, in terms of cost, many nurses remained unemployed or in volunteer positions, and they switched to nursing from other fields. And so it's unclear if those other fields would have had greater development impacts on the Philippines as a whole. And so ultimately, as I said to Alex, I think what our paper does is it provides evidence of these partial equilibrium effects of demand for foreign nurses on education in the origin country. But the overall welfare calculations are a bit beyond the scope of what we've done here. But I think, there's lots of people who are doing awesome migration work on this webinar right now. And I think this is a really important area for future research going forward. In terms of policy implications, just to conclude, I think our results provide really useful evidence for many low to middle income countries that are trying to facilitate labor migration in a similar process to the Philippines. So Indonesia, India, and other countries that have a very similar setup, I would say, to the Philippines and how they're thinking about migration. I should emphasize again, though, that this may not apply to the most underdeveloped countries, particularly those that have limited post-secondary infrastructure. This is going to require countries like India or Indonesia that are going to similarly be able to respond in terms of their higher education sector. I do think our results highlight the importance of well-designed partnerships between destination and origin countries, and the importance that these sorts of partnerships can have. They can essentially allow destination countries to subsidize training for workers in origin countries while facilitating this migration of skilled workers and the subsequent development impacts. So that's all I have for you, but I would love to hear any other questions or comments you have. Thank you so much for having me.
Thank you very much, Caroline. So we'll now open the floor for questions. I'll keep these, I don't know if anyone wants to take the lead.
wonder if I can ask a question?
Pedro, please.
So I could not follow very well the part on the identification, and I was wondering if your estimates are in some way biased downwards, because actually in the control group you also have provinces that potentially were affected by the intervention. Could this be the case?
Yeah.
And the second question, I was wondering about some sort of upstream effects. So you focus on post-secondary education enrollment. I was wondering if some students that are attending secondary school, they may be wondering that actually now the chances of getting the visa have increased, and therefore maybe I should work a little harder, get better grades, make sure that I do not drop out, so that eventually I can attend these courses and get the visa to earn 10 times more in the US. So could you look at grades and completion of secondary schools across these provinces as well?
Great, thank you for those. Yeah, so I think your point about the results being biased downward is an important one, because we don't really have a true control group, right? We have a control group that's less treated. And so I think that the results could in fact be biased downward. I think that, you know, one of my former professors encouraged me that maybe I should just look at it in the time series because it's pretty compelling in the time series, and then we don't get that bias downward. Other feedback has kind of pushed me in this direction, but I think you're right. If you have suggestions of how to address that, I would love to hear it, because I'm kind of, I think a lot of people see these results as so big anyway that I haven't emphasized that too much in the paper, but I think that you're absolutely right. Our control group is in fact experiencing part of the treatment. So thank you for bringing that up. In terms of secondary school, I think this is really important. I have another paper looking at the effects of temporary migration on secondary school completion. I find pretty significant effects as demand increases for temporary migrants, not for nurses, but just temporary contract migrants more broadly. There are large increases in terms of secondary school enrollment and completion. There's no reason I couldn't take those same data and look at this here, because I think that certainly for the Philippines, I think that my hunch would be that would be happening. You know, for the Philippines, for each for every migrant that goes abroad, there are about 4 households that receive remittances. So this isn't just, you know, some channel between me and my home of origin. There are lots of beneficiaries of these remittances. And a lot of times what you see, kind of more anecdotally, but if you talk to households, they pool resources to send one daughter, usually, to nursing school, who is then going to facilitate the education of siblings and cousins across multiple households. And so I think that sort of the connection between post-secondary and secondary training is a bit more salient maybe than in some other contexts we might think about. So that's a great suggestion and something that I can easily add to the paper. So thank you for that.
Okay. Any other questions?
Maybe a small question on the selection process of people that apply to the visa. I was wondering if they were taking into account the location of individuals in some ways. And also I was wondering if you had the rate of successful application by area.
Yeah, so in terms of if they're taking into, so I think they're taking it into account only in the extent of how much these migrant networks matter. And so there are like recruitment agencies that are set up. So there are recruitment agencies in the provinces of origin. There are also recruitment agencies in Manila, where it's really fascinating. I have some data on the recruitment agencies that people use, and you can see that even the ones that are in Manila, even all on the same street, people from a given province go to the same one, even though they could go to the one next door. So I think that kind of speaks to your point about, say I'm going and my cousin used a specific recruiting agency, I'm more likely to go to that one. Maybe that's a better recruiting agency and I'm more likely to land a job, something like that. And then remind me your second comment.
So the second comment was more if you had data on the rate of successful application by area or something like that.
Yeah, so I know, so I don't know about I don't know the denominator of how many people applied, I guess I would say. So I know how many people actually go on a visa, but I don't know how many people would like to go. And I think this kind of goes maybe to one of the points that Pedro made, that I don't know like the aspirations of them when they started. So I don't know that like, 1,000 people enrolled in nursing school, 500 applied to be migrants and 100 were selected. I don't know the 500 that actually applied. And so I think going to your point and to Pedro's point, even just some qualitative evidence where I can get, some suggestions. And I think there's probably some work by some sociologists and anthropologists in the Philippines that have looked at this about what people are intending to do when they start nursing school and what they actually do when they finish in terms of rates of application. So so that's something I'm definitely going to look into. I appreciate both of your comments on that. Thank you.
I also had a question, if I may.
Yeah.
So it's kind of linked to the comment on the institutional effect of migrants, but I was wondering, given the important impact of the US channel for nurses in general, is there any evidence of the nursing programs, or let's say the nursing system in the Philippines kind of converging a bit towards what is done in the US, in the sense of, given that it's so massive in terms of channel, is the training becoming a bit more tailored towards what the US would require? And linked to that, could there be any impact on the pass rates that you see that you analyze in the paper, in the sense that if the exam becomes tougher, because now the standards that they require, given that many of these workers are foreseen to go working to the US, given that these standards might increase, could that explain that that you would observe something on the pass rates? And kind of linked to that, something I would find interesting, but it might go beyond what you're doing in the paper, is whether you find any heterogeneous effects in terms of pass rates among areas where you have a bigger increase in programs or in schools providing this type of program, compared to areas where you don't observe such a big influence of new programs. Because when you were talking about the quality, I think you kind of implicitly were saying that we see all these schools, and given these many new actors, we could fear that the quality is decreasing. But if the US has such a big magnet effect, couldn't it? One could argue. I mean, it's purely speculative here, but one could argue that these new schools could be tailoring their programs towards the US.
Yeah, thank you. These are great suggestions. So kind of going through some of them. So I think in terms of the link to the US, certainly the way the nursing system was set up in the Philippines was very much based historically after the US system. And even the exams that were written were tailored to mirror US exams. So I think that that's something that has happened historically. Now, one thing that I was reading about recently, and that I'm hoping I can do with our data, is that what's happening in the Philippines is people are specializing in fields that would be of more use in the US, like geriatrics, for instance. And so if you specialize in geriatrics and you come to the US, great, you're going to have lots of employment opportunities. Philippines is a young, developing country. It's going to be a lot less useful to be doing that. And so, so I think you're exactly right that if we can look at any of those kind of tailoring things, it kind of gets at this like counterfactual, which I'd really like to be able to pin down, of like what ends up happening to them when they stay in the Philippines. So that's kind of not the point you were making, but I think that it kind of dovetails with that a little bit. And I can I'll try to find some more evidence on that, because I do think that the US, I think the US, I don't want to say has entirely influenced the nursing system in the Philippines, because that's not true, but it has had a huge influence on it historically because of this channel. In terms of the heterogeneous effects on pass rates in areas with new programs versus not new, that's an awesome idea. I think that I should definitely do that. I think the other thing that it lets me do potentially is try to separate out if it's coming through the nursing student themselves being marginal or the school being marginal, because in areas that have lower increases in nurse programs, it's the student that's changing, not the pass rate. So that's a fantastic suggestion. So thank you for that. And then I think your last point was about let's see, I'm looking at my notes. I guess that was the last thing I wanted to say, but those are all those are such great points. Thank you so much, Joel.
Okay, not sure anyone Anyone else wants to add to the discussion? Maybe I can just make a minor point. So when you're saying that, okay, so this is evidence that speaks mostly to, these middle income economies, let's say. I would argue this specific example, and policy change that you're looking at speaks to that. But I think, we cannot exclude that this is happening also in other contexts, right? So, the original brain theory, and maybe that's what you were exploiting in the temporary migration case, puts it that, you just, the simple fact that people realize, potential migrants or their parents realize that the return to immigration will be higher abroad, that will prompt this increased education, right? So I would not exclude it, okay? So you speak mostly to this context, but I would not exclude the original hypothesis that we have seen having support in other contexts, and that could also still apply there. This is just a minor comment here. So I think we all thank you very much for this great presentation. It was a pleasure to, see you at least virtually before you out in Lisbon soon. A big thank you again, and hope to meet you all again very soon. Thank you.
Thank you all so much for the excellent comments. I really appreciate it.
Thanks.